get home or have nothing to eat. I mean, I've seen it too many times. I've had the fortune to be a dean of students at a college, so I understand what you're trying to do here. And with the prevailing position that our federal government has taken now regarding cuts, like we've already talked about our kids and the breakfast program, 16 million gone, whatnot. I applaud you for trying to get us to step up to the plate, because we are going to have to step up to the plate to fill in all those voids, and this is a void that you're trying to fill. So I compliment you on that.
Thank you. You know, I think as we promote students being active and volunteering and making a difference in their community, that's how they learn to grow up, and they go back home and they do those same things. And this is a good program to help them get started.
Okay. And I move at the proper time.
Okay, well, why don't you go ahead and move
So
it,
moved.
if you don't mind, and second, Senator Figures seconds. Any other discussion? It's just a program that we hadn't funded, but, you know, we can do that if we so choose. All right, any objection to the previous roll? All right, seeing none, 15 ayes, 0 nays, the bill's given favorable report. Thank you, Representative
Thank
Collins.
you so much, Mr. Chairman and committee. I appreciate it.
Okay, clerk, call the next bill.
House Bill 379 by Representative Garrett.
All right, I'm handling this for Representative Garrett. This is for this is a model bill from the
Good morning, everyone. We'd like to call the meeting for April 30th to order. Michael Ann, if you would, call roll.
Representative Lee.
Here.
Representative Lipscomb. Here. Representative Hall. Representative Sorrells. Representative Mooney. Here. Representative Warren. Here. Representative Marcus. Here. Representative Gray. Here. Representative Rafferty. Representative Paramore. Here. Representative Rigsby. Here. Representative Holt Jones. Here. Representative DeBose. Here. Representative Shiree. Representative Brinyard. Here. You have a quorum.
Thank you. Representative Warren, I understand you have a page that's with you this morning.
Yes, I do. I have Jason Waters. He's in the 5th grade.
Please stand up, please, sir.
Stand up, Jason.
Yeah.
He's in the 5th grade at Payne Elementary School.
Okay.
In Trussville.
Well,
And he's the grandson of Henry Davis.
okay. Good to have you here. I believe we have other pages in here that may have their legislator in another meeting or somewhere. If you're a page this week, if you would, stand up and tell your name, what school you go to, and the city you're from. All right?
I'm Drew Matthews, and I go to Jasper High School.
All right. Good to have you. Good to have you. Yes, sir. Hoover. Okay. It's good to have you. Say that again one more time. Okay. Good to have you. Okay. Thanks. Thank you. Good to have you. Yes, sir. Westbrook. All right. Okay, good to have you. Yes, sir. Park Crossing. Okay, good. Yes, ma'am. I see you way back there. Arab. Okay, thank you. All right. It's a good opportunity for you to see a lot of things up here and see how the process works, and it's a good learning lesson. There's nothing like a real-time learning lesson after you've studied in school and understand how the actual flow of it goes. So, all right, we have two bills on the calendar today. Representative Reed, or Chairman Reed, are you here? Or Ingram, are you here? All right, well, he and I talked. He wanted to carry this over, but I was going to allow him to do that. But we had the public hearing last Wednesday, and Tuesday night there were some things that came out that I didn't know about, and maybe one here did or mentioned it, but we had not seen it. So there are attempts and works going on to deal with this very issue at the federal level, and Chairman Reed or Chairman Ingram I just said, let's just carry it and see. But I committed to him that next year we would look at it and see where they are at the federal level, and then the first part of next year we would work on addressing it and see what we could do to move forward with it. There's some date starts. You know, if it happens, inventory, if you're in business, you understand there's some inventory that's out there, what happens with that and how they work it. And he understands that. So he said he'd like to see what happens at the federal level. But next year, if it has not moved forward and there's no defined direction of which way it's going, then we would address it at the state level.
Chairman,
Yes.
may I make a motion to carry over the bill, and I do it with great support to the issue and understanding of what we're facing in relation to the products we're dealing with, and thank you for the things you've said about it.
Yes, sir. I have a motion to carry over. Second. All those in favor by carrying it over by saying aye. Aye. Good. We carry that bill over and sit and wait and see what happens. If not, we will look at it next year. All right. Next bill on the calendar is Senator Orr's bill, SB 85. Okay. Representative, go ahead. Yes, sir.
Chairman and members, this bill should be a simple bill. It's just a streamline a process that is already legal. It's the religious exemption. This would allow for simply a note from a parent or guardian. Thank you, sir. But it would allow for a note or from a parent or guardian for religious exemption from vaccines and/or testing, and that would come into line with what 26 other states are already doing. We're just a little late to the ball game. Right now, the process is cumbersome. Some feel like it's harassment. You have to go to the Department of Education, watch a video, and sign some stuff. And some parents have really felt harassed by that for their religious liberties and parental rights.
Okay. There has been a public hearing. We will vote on this at the end of the public hearing, but there has been a public hearing called. Would you like to call?
3 minutes.
Yeah, 3 minutes, and I'll just remind you of our rules. Give you 3 minutes, and at the end of 3 minutes, we try to do it for everyone, or we do it for everyone. If you're in the middle of a sentence, we're going to cut you off in 3 minutes. So that's the fairest way I know how to do it. Thank you.
Ted Halley.
Hello, all. First of all, thank you for serving. Appreciate what you do. I'm well underpaid and overworked, but anyway, and I thank you for everyone being here and the opportunity to express my opportunity to voice my opinion. As a parent and a grandparent of 11 grandchildren, 5 children, this is near and dear to my heart in that we have seen over the last few years that vaccines as guaranteed to be safe are not necessarily so. And I think it's very important that not only in the K through 12, but in the higher education, that this be optional, not forced down our throat. As you know, during the COVID pandemic, the universities of Alabama forced this on their students. Very dangerous thing, and they should have the ability to say no. As you know, there's two sides to every coin. Some people love the COVID vaccine. Some people like me hate it. And, when I look at the research, we see things like young athletes falling over dead on the field. Shouldn't happen. And they just had the vaccine. We're seeing a skyrocket of turbo cancer in young people that is unaccounted for. But gosh, seems like they all had the vaccine. And, it's just not right. And plus of that, it was experimental. And those of us that have, a Christian point of view and fetal cells and stuff, we don't like it. So, we need to be exempt. But there's not just this. There's other ones like our new RFK is looking into the vaccine cause autism. Well, maybe we need some relief so that we don't have so many cases of autism. And then probably the one that's also near and dear to both sides is parental choice and rights. As a parent, know what's best for my children. I'm a custodial grandparent. I know what's best for my grandchild. So we need to have this freedom. We don't need to have vaccines crammed down our throat, and we need to have the freedom to be the parents and grandparents and adults that we are. Thank you very much.
Thank you.
April Hartsfield.
Good morning, Mr. Chairman, members of the committee.
Morning.
I am April Hartsfield. I am the Kids Count Director at Voices for Alabama's Children. Thank you for allowing us this time to speak about SB 85. Voices' mission is to speak for the well-being of Alabama's children. We do this through research, public awareness, and advocacy. While we appreciate the right of parents to make the best decision for their own children, a system is already in place that allows parents to do just that. Our concern about this bill is that it will circumvent the system that is already in place and effective. And this will likely have a significantly negative effect on Alabama children who are immunosuppressed and infants who are too young for vaccinations. The system that is already in place for parents to file religious and medical exemptions for vaccinations required for entry to school allows schools, pediatricians, and other healthcare providers to know about and respect these exemptions. It also allows the state officials to monitor and identify when and where outbreaks are most likely to occur and to quickly and effectively deploy resources to address and contain those outbreaks. This bill, by throwing out a system that works in favor of one that is random and unsystematic, will prevent health officials from being prepared to respond rapidly to outbreaks. And with highly contagious diseases that can spread rapidly, such as measles, as we are watching happen right now in Texas and in at least 29 other areas across the country, time is of the essence, and systems that allow rapid response benefit the public's health. The system we already have in place has successfully suppressed the spread of contagious diseases for decades. It isn't broken and doesn't need to be fixed. And we don't need to move Alabama backwards by being unable to monitor for outbreaks effectively. As I mentioned, Voice's concern is for children, especially those who are immunosuppressed and cannot be vaccinated. These outbreaks with the measles, they significantly impact this population that we're concerned about. To date, there are 884 cases nationwide. 68% of those cases are children and youth under 19 years old. 97% of the cases are either unvaccinated or their vaccination status is unknown. 11% of the cases have been hospitalized, with the under 5 years population representing the largest hospitalized group. Measles is a serious viral respiratory illness that lives in the nose and throat mucus of infected people. One person with measles can infect 18 unvaccinated individuals. Up to 20 to 30% of infected people have complications with the disease, especially children under 5 years of age or adults over 20 years of age. So it is important to have as much time as possible to identify and deploy resources that can stop an outbreak and reduce.
Thank you. Thank you. That concludes our speakers. Representative Butler, if you would.
Yes, I would just like to to point out that this is already legal. This streamlines the process. That during COVID, we saw that parental voices were muted, religious liberties were muted, and this literally gives voice back to the parents for religious liberties.
And just clarify, this is not just for the COVID shot.
That's correct.
This is for all vaccines.
Vaccinations and testing, yes, sir.
Okay, any questions? Representative O. Jones?
I was just confused on the word testing. I mean, it refers to students, so I mean, is it school test or medical test or?
Yes, as I understand it, it's when they were required to test every other 15 minutes during COVID.
Test who for what?
Everybody and their brother, everywhere you went, was tested for COVID. There was some
testing on site.
Oh yeah, for COVID. I'm sure it took place right here in this legislature. We weren't here, some of us, during that time, but yes, testing took place everywhere. Some of those rapid tests.
But your bill is not specific. It just strictly says all testing.
Well, we could easily fix that on the floor.
Thank you.
Anyone, any more questions? Representative Rafferty.
Okay, Representative, in researching this bill, I couldn't find a single religious denomination or that excluded vaccines wholesale. So I'm just wondering, why don't we just call this what it is, which is a personal exemption, instead of trying to call it a religious exemption?
Well, it is a religious exemption is what we were asking for.
Well,
just a simple parental note would take care of that. Just simply streamlines the process. You wouldn't have to go to the health department, wouldn't have to watch a video, wouldn't have to go through any of that. You as a parent, if you wanted them exempt, you simply could do that. It would restore your voice.
So also I understand that the COVID vaccine is not required for school. I mean, pretty much what we're talking about is the MMR vaccine, correct? Is that primarily what we're concerned with here?
It would cover whatever the parent objects to.
I'm asking you,
So it can get a lot.
Specifically, what is the big concern here with?
Well,
is
COVID
it
is
primarily with the MMR vaccine?
COVID is what brought around so many of these bills. Is so many people were upset by what took place.
Right. Well, I mean, so we have seen outbreaks of measles in other states where we've seen personal exemptions like this been legalized, including the death of children in those cases from complications from encephalitis and such. So I am concerned about what we would do in being able to alert the parents of kids who don't have vaccines that they might be at a higher risk of contracting a very potentially serious disease from measles, that there is an outbreak in their school or around their location or daycare or whatever it might be. So for those reasons, I still have some very serious concerns with this bill. And if you were open to it, I would be really appreciative of your time to sit down and kind of maybe work through some of those issues if possible.
Sure, and the process is already there. This just streamlines it, makes it easier for the parent to do.
Okay, well then maybe we can.
They can get the exemption now, but some feel like they are being harassed when they do so.
All right.
There's even some instances where the parents were charged, if you saw on the news, and that those monies had to be refunded later.
Charged with what?
I believe that was in Mobile. They had to pay for the exemption.
Okay, gotcha.
Pay for the religious liberties.
I understood. Okay. I understand where you're coming from. I'm just wondering if you would be willing to sit down and talk with me about this a little bit more. All right. Thank you.
Any other questions? I believe I heard a motion. Representative Lipscomb. Second, Representative DeVos. All those in favor are giving a favorable report by saying aye. Those against, nay. The bill passes with favorable report.
Thank you.
All right, that ends our meeting. However, let's just stay close, and because I'm not sure what will come in tomorrow, a Senate bill, and we fall under the, I guess, 2-hour rule or 4-hour rule, whatever it is, that we can call a health committee meeting. So just keep your ears open in case we have to do that. So thank you.